Hi everyone, and welcome to the Digitodontics webinar series. This is Mahmoud Al-Bashti with you today from Digitodontics International Academy. It's our pleasure and honor to welcome our guest speaker, Dr. Alessio Casucci from the University of Siena, Italy. Dr. Casucci will share with us his experience in the simplified treatment of edentulous patients, an update on digital options. Dr. Alessio Casucci received his DDS degree from the University of Siena in 2004, Italy. He holds a master's degree in the periodontology and a Master of Science in Dental Biomaterials from the University of Siena, where he also completed his PhD in dental biomaterials and their clinical applications. Dr. Alessio is a professor at the postgraduate program International Master in Prosthodontics at the University of Siena. And he is a lecturer in several courses on complete dentures and implant-supported prosthodontics. He published different papers in international journals and a book author in Static and Function Incomplete Denture Digital Perspectives. He is the member of the International College of Prosthodontists, the European Prosthodontic Association, and the International Team for the Implantology. He is the founder of the SIBRO, the Italian Society for Prosthodontics and Oral Rehabilitation. He is a prosthodontic specialist at the European Prosthodontic Association. He mainly devotes the clinical practice to edentulous patients rehabilitation with implants and digital protocols. So just before Dr. Alessio starts, I would like to raise your attention that if you have any questions, please write them on the Q&A session. And once Dr. Alessio finishes the presentation, he will be happy to answer all these questions. So once again, let us welcome Dr. Alessio, and without any delay, let us start. So, Alessio, thank you so much for accepting our invitation here today to share your experience with us. So, please share your screen.
Thank you for your presentation, and good evening to everyone. I'm really honored to participate to this webinar, and with many other colleagues, very high level scientific and clinical colleagues. So the topic of today is the treatment of the patients, the edentulous patients, and I would like to share with you my experience and my transition to digital. I started some years ago with analogic, but I think that digital is really interesting for many aspects. I live in Tuscany. I live in Siena, and I work there. So just a few images to present me and my places. What I'm going to discuss is about complete dentures and protocols, and what we can do on Monday morning to treat our patients, and how to try to simplify our protocols. Definitely the protocols that are based on digital technologies can achieve a good quality, high level of quality of our prosthesis, and also we can save time and we can simplify the treatment for the patient. That is really important for the age of the patient and the characteristic of our patient. And then we are going to draw some conclusion together. Our population, especially in Italy, is going older and older in the last years. And in Italy, we have a lot of patients that are over 65 and 75 years old. So basically, I treat patients, and the majority of them are older than 65. So we are treating the patient on the right side of the slide. instead all of the ages. And we are expecting in Italy and in some in some other countries, we expect older and older patients in the future. So it's really important to adapt our treatments, our protocols, and our approach to this kind of patients. When we treat an edentulous patients, we can offer to them different solutions. We can have traditional protocols, simplified protocols. We can have also digital protocols, and we can treat them with denture, that is the easiest solution, or with supported or retained or supported prosthesis. So basically, complete denture, it means to treat an edentulous patient and sometimes to treat a patient for a temporary solution that can be changed and can be moved to the implant solution. So my question is if we are really prepared to the digital. And the meaning of this presentation is to share with you my transition to my approach to digital. Today, digital is really important because we can simplify our treatments. In this case, for example, I treat this patient with a terminal dentition with 2 immediate dentures. And it was really easy to register the arches with a scan. We can easily use the scanning for these cases, and it's a really predictable way in order to obtain all of the data. We have also to register a position of the arches. In this case, we can use the teeth, but in many cases, the teeth are in periodontal condition. They can move, so we have to reestablish the proper occlusal position. And anyway, we can use the digital to register this aspect and to send to the lab the information that are required for the teeth arrangement. So we can give to the software, in this case 3Shape, we can use the software in our patient, for our patient, in order to reposition teeth, to measure the position of the teeth, and to understand before the delivery what we can expect when we deliver and we position the prosthesis in the mouth. So it's really a very short protocol, just scans, occlusal registration and processing in the lab, just to obtain the prosthesis. And in this case, I cannot have the time to discuss all the detail of this case, but we are going to discuss other cases after. We can use also the roots of the remaining roots of the patient to stabilize the lower denture. That is really important for the patient to adapt and to move from a terminal dentition, a bad condition, to a new position and a new prosthesis. So with digital, we can do this in a very short time, and we can really simplify our protocols. Usually the conventional protocol in complete denture is really long. We need a lot of registration, we need a lot of details, and is in some cases is still really important to have all of these steps and all of this data. But with digital, we can also simplify. So the old approach, to denture is not finished, is still important. But now we are in a transition. We are in the age of the metamorphosis to the digital. So we can just use some concept, all of our knowledge from the analogic to the digital world.